Hello everyone, here you are seeing the condition called Cushing syndrome, where centrally central fat is accumulated and peripherally the limbs and all are thin. See, I named the name. What is the name of the adverse effect? That is Cushing syndrome. What is the mechanism of this adverse effect? The more fat and glucose will be there, so only they become fat, increase blood glucose level, increase free fatty acid, and about proteins you are saying negative nitrogen balance. Because more proximal negative nitrogen balance means when formation of nitrogens will be less than the degradation of the nitrogen, like that is proteins, that we call as negative nitrogen balance, because there is a limb myopathy or atrophy, so there will be negative nitrogen balance. And this Cushing syndrome is caused by corticosteroids. Name other four adverse effects of this above mentioned drug. You can remember as glucocorticoids name. So corticoids will cause us the same adverse effects. You can remember the mnemonic through the mnemonic glucocorticoids only. G for glaucoma, L for limb atrophy or limb myopathy, U for ulcer, C for cataract, and other C in glucocorticoids you get for Cushing syndrome, and 2O you will get for osteoporosis and osteonecrosis, and you will get a D in that. So it is contraindicated in diabetes as it causes hyperglycemia. It is contraindicated in diabetes mellitus. And I in glucocorticoids is for infection because of immunosuppression. Glucocorticoids causes immunosuppression, so infection, they are more prone for infection. And other glucocorticoids is done like these are the adverse effects. You can remember through the name glucocorticoids again: glaucoma and limb myopathy, ulcer, osteoporosis, osteonecrosis, contraindicated in diabetes mellitus, and then I for immunosuppression, so infection more, and Cushing syndrome and cataract. These are the adverse effects of glucocorticoids. Next, how do you prevent this condition? Glucocorticoids should be taken for a short duration of time, because now all these adverse effects will be caused by the glucocorticoids or like any corticosteroids. So you have to take for a short duration of time, and then tapering, that means lowering the dose, and then gradually you have to stop the treatment. This is how you prevent this condition. How do you prevent this adverse effect? Treatment should be taken for a short duration, tapering the dose, and stop gradually. This is how you prevent this condition. Again, and this condition is called Cushing syndrome, caused by corticosteroids. Mechanism of action is increased free fatty acids, increase the glucose level in the blood, and negative nitrogen balance. And other adverse effects of glucocorticoids are glaucoma, limb myopathy, osteoporosis, osteonecrosis, cataract, Cushing syndrome. Immunosuppression causes infection and contraindicated in diabetes mellitus. These are the adverse effects of glucocorticoids or corticosteroids. And how do you prevent this? By shortening the duration of treatment and tapering the dose and gradually stopping. This is how you prevent this condition. If you find this video helpful, please do like, share, subscribe to my channel, and if you have any suggestions, let me know in the comment section. Thank you.